Hello, and welcome back to the Psychiatric Mental Health Nurse Practitioner Review. We're going to talk about violence and grief. So, intimate partner violence. So, this is violence that is physical, emotional, economic, or sexual pain and injury that is intentionally inflicted by a person's intimate partner. The goal of the abuser is to establish power, manipulate the other person, intimidate the other person, or control the other person. Characteristics of abusers are typically they have some sort of personality disorder, so whether that is antisocial, borderline, or narcissistic, there can be environmental stressors and financial difficulties. It typically occurs among all types of relationships that are intimate in nature. It's the leading cause of injury to young women. It's a leading cause of death among African American women. 1 in 10 female high school students in the United States have reported violence from their dating partners. 15 to 25% of pregnant women are physically abused. 22 to 35% of women seen in the ED experience injuries as a result of intimate partner violence. 1 in 3 women and 1 in 4 men are victims of intimate partner violence. So that's important to note. It is almost equal between men and women. A lot of people think that this is men inflicting it on women, but women also inflict it on men. 50% of homeless women experience intimate partner violence. 63% of men incarcerated for murder between the ages of 11 and 20 have murdered their mother's abuser. And 33% of male abusers are well educated and include men in professional jobs. So risk factors for abusers, exposure to violence at early developmental ages, low self-esteem, social isolation, lack of support, cognitive impairments, and physical and financial dependency. Prevention and screening, so public education and awareness beginning in high school, social programs, at-risk family education, and community education to reduce stigma, to allow victims to come forward, signs and symptoms of being the victim of abuse, prevention programs, early recognition and intervention and treatment, and routine screenings in all healthcare settings. So when we are assessing for this, we want to get a good history. So we want to assess for accidents, suspicious or repeated fractures, physical injuries, traumas, refusal of ongoing treatment or follow-up, and missed medical appointments. Physical exam findings, we want to monitor for nutritional status for dehydration and malnutrition, look for lacerations, bruises, wounds, burns, and fractures, and look for poor skin and personal hygiene. Mental status findings, typically people who are being abused will be fearful, evasive, guarded, depressed, passive, and dependent. Most state laws mandate reporting of suspected abuse and neglect of vulnerable populations, which include older adults, people with disabilities, and children. So Tarsoff's was a case called Tarsoff's versus Regents of University of California. So mental health professionals have a duty to warn or protect endangered third parties if there is an immediate threat of serious harm or an identifiable endangered third party. Options for mental health professionals include voluntary or involuntary hospitalizations, warn the intended victim of threat, notify the police, adjust medications, and see the patient more frequently. Legal mandate to warn varies state by state, so know your state's policy. As far as the exam is testing on a nationwide basis, so you will not get a question that pertains to your state. If you did get a question like this, the answer would be to check with the Board of Nursing because it is different for each state. Non-pharmacological management, so safety and medical well-being of the person experiencing the abuse is most important, and refer the person to a domestic abuse shelter when feasible. Help the person to develop a safety plan so you can come up with a code word for family or other support systems to inform them that they are in need of help. Advise the client to tell one person in his or her support system about the situation. Advise them to pack an emergency bag and hide it in case they need to leave quickly. Advise the client to keep an interpersonal violence, intimate partner violence hotline and other telephone numbers in a secure place. Monitor medical status as symptomology presents. Monitor nutrition status and vital signs. Suggest psychotherapy or suggest hospitalization when in the best interest of the client. So then we're going to talk about sexual assault and abuse. Sexual assault or abuse is a sexual act committed through coercion or physical force. This includes all of these things listed here. It is an act of violence and humiliation expressed through sexual means. It is used to express power or anger. Sexual assault and abuse is the most common form of abuse. It refers to an act of violence through humiliation and sexual means, often perpetrated by somebody known to the victim or in close proximity to the victim's house. So 59% were acquaintances, 34% were family members, and 7% are strangers. Victims and perpetrators can be either gender. So women have a greater incidence of being assaulted than men. Sexual assault is the most common form of abuse. Perpetrators are more frequently men than women. Alcohol is involved 34% of the time, and only 1 in 4 is reported. Factors that increase abuse, so substance use disorders, psychiatric disorders, divorce, family or physical history, long-term exposure to violence, social isolation or lack of support, environmental stressors such as unwanted pregnancies, intimate unemployment, or financial difficulties. So prevention and screening. So public health education for awareness, the cycle of domestic violence. So the relational pattern characteristics of many abusers, there is a tension building phase. This is terrorized by instability, the feeling of walking on eggshells when around the abuser. This lasts for months, hours to months. The victim engages in appeasement and avoidant behaviors in order to prevent the abusive incident or garner sympathy and positive regard. Then there is the abuse incident. This follows the tension building phase. It's characterized by overt aggressive behaviors. There's some examples there towards the victim. And then there's a honeymoon phase. This is a stage marked by the abuser subconsciously impeding defense mechanisms and cognitive distortions to alleviate the ego-dystonic implications of the abuse. So undoing, denial, reaction formation, suppression, and regression. Stigma reduction to enhance reporting, community resources and support, community emergency shelters, assertiveness training and self-defense, and routine inquiry, so asking about it during encounters with us medical professionals. So assessment, we want to interview the persons who have experienced the assault alone when possible. We want to establish trust and promote sharing. Red flags during an evaluation, so incongruent injuries, overly involved protective partners, recurrent similar injuries in unusual locations, refusal of treatment or missed appointments, nutritional deficiencies or unexplained weight loss, unusual frequent complications of treatment, and a change in hygiene. People who are being abused will seem withdrawn, frightened, they might be hyperreactive to touch, have associated findings, unexplained bruises, STIs, rashes in lower regions, areas where the abuse is occurring. There could be like tears and swelling. All right. We're going to see, again, withdrawn, frightened, anxious, hyperactive, dissociating. Things that we need to document. So forensic specimens, pregnancy tests, cultures, STI tests. Non-pharmacological management. So ensure safety and well-being, ensure confidentiality, accurately document. Note that there is the potential for harming themselves. Cognitive behavioral therapy can help as well as support groups and community resources, assist to access to criminal and legal supports, devise an escape plan, give hotline numbers. So lethality assessment. So this includes an evaluation, screening, or testing. Lethality refers to the likelihood that the person will unalive themselves or unalive somebody else. Violence is the behavior or the expression of anger, rage, and hostility that is demonstrated by the use of physical force directed towards another person or property. Violence in school, so we'll see this physical fight with peers, destruction of property, severe rage for minor reasons, threats of violence, possession of firearms or other weapons, self-injurious behavior, bullying or being bullied, and if warning signs indicate that there's an immediate danger, safety must be first and foremost. So when we're talking about like violence or harming themselves, we always want to assess for like, is there a plan? And, is there a history of either of these things happening before? Because then the likelihood of it happening is higher. Also, we want to assess for, is there access to firearms in the home? That is, again, another makes it a little more dangerous. All right, so let's talk about assessing harm to self and harm to others. So risk factors, so substance use disorder, job financial problems, relationship problems, mental health problems, or easy access to lethal means, so fire in the home. These are all risk factors. Also being a veteran, living somewhere rural, being a sexual gender minority, middle-aged adults, and tribal populations. People who have adverse childhood experiences, higher levels of it, sexual violence and other health disparities are at a higher risk. And these graphs are related to self-harm, not harming others, but we can see higher rates in males than females, and we can see it's actually been increasing over time, and then higher rates with different cultures. And again, there are those rates, again, for age, adjusted for age. So you can see if you look at the deaths per 100,000, you can see how much higher males are versus females. So risk factors, people who have depression, a prior attempt, up to 50% of unsuccessful victims have made a prior attempt, family history of mental disorder, substance use, family history of that, unaliving themselves, family violence, firearms in the home, incarceration, and males are 5 times more likely than females, and white males over the age of 85 have the highest rate. Mnemonic for warning signs related to unaliving yourself is path warm. So ideation, substance use, purposelessness, anxiety, feeling trapped, hopeless, withdrawal, recklessness, and mood changes. Signs of imminent danger include threatening to hurt themselves or somebody else, looking for ways to do it, talking or writing about death, plan or preparing to do it, and then alcohol use. Now, when we talk about wanting to hurt others, is there a prior history of threats or violence? Any paranoia? Though that's going to be a warning sign. A fascination or preoccupation with weapons, extreme stress, identifying incidents in the workplace, violence reported in media, and others condoning or sympathizing with those actions, being a loner, engaging in frequent disputes with supervisors or coworkers, persistently violating company policy, obsessive involvement with one's job, particularly where it occurs with no apparent outside interest, and then volatile and violent at home or other situations that potentially bring violence into the workplace. So talks a little bit about workplace at the end, but we're looking for those signs of paranoia, history of violence, conflicts with people around them, regardless if it's work, school, sympathizing with people who have committed similar acts of violence. Threats of violence, things we're going to see, verbal threats, throwing objects, gestures, posturing. We might see a display of intense or obsessive romantic interest that exceeds the normal bounds of a normal relationship, attempting to intimidate or harass other people, behavior indicating that the person is significantly out of touch with reality, volatile or violent personal situations, alcohol or substance use. So from a nursing standpoint, safety is the number one priority. So any questions on the exam related to whether it's harming oneself or somebody else, it's always safety first. So what is the answer that is going to provide the most safety for that patient right now? That is the priority. Okay. So elder abuse and abuse of a disabled person. So we know what physical abuse is, emotional, psychological abuse, financial abuse, neglect, or sexual abuse. This can all occur in the elderly population. And then grief is a sudden or traumatic loss, death of a child or loved one in social isolation. These are all risk factors. Relationship between bereavement and the deceased has been extremely close, ambivalent, or dependent, lacking social supports, past history of mental illness, and other major stressors. So there are stages of grief. Kubler-Ross's grief cycle. So there is the first stage is denial. Then it goes to anger, depression, bargaining. So bargaining is like struggling to find meaning, reaching out to others, telling one's story, trying to figure it out. And then they get to an acceptance stage. Prolonged grief. So grief over the death of a person who is close to the bereaved individual can last at least 12 months for adults and 6 months for children. One or both of the following symptoms have occurred most days since the death and every day for at least the last month. So intense yearning, longing, preoccupation with thoughts and memories of the deceased, and then 3 or more of the following. So identity disruption, avoidance of reminders, intense emotional pain, difficulty reintegrating into relationships and activity, emotional numbness, feeling that life is meaningless, and intense loneliness. Risk factors, so a sudden or traumatic loss of the person, being very close to that person, lacking social supports, a history of mental illness, and treatment options. So SSRIs can be helpful with depressive symptoms, and psychotropic medications will not change the sadness associated with grief, but psychotherapy can also help, specifically CBT and interpersonal psychotherapy. All right, and that is the end of our discussion. I'll see you next time. Bye.